Hello friends, welcome to the healthcare today. So today we will be discussing about fatty liver and fatty liver disease. It's very important to understand what is fatty liver. So as we all know, liver is the most important organ in our body as per the functions are related. So it almost has 500 functions of the body. So liver, actually we have to understand where is it located. It is located from the nipple till the ribs. It is almost 1.5 kg of organs. And second, we have to understand the amount of fat which is normally present in the liver is 5%. So if somebody has fatty liver, means he has more than 5% of fat content in the liver. When the fat amount is present in the liver cells, the amount of damage starts happening and it causes fatty liver disease. So there are two things we have to understand. One is the fatty liver, that means the liver has more than 5% of fat, and second is fatty liver disease, where the fat is causing problems or the damage in the liver. So that is, the first one is the first hit and the second one is the second hit. We have to understand when is the fatty liver and fatty liver disease is occurring in our body. So it is very important to understand that fatty liver is very common in our India as well as globally. So almost 6 to 7 persons out of 10 has fatty liver. You have to understand the important signs and symptoms of fatty liver and fatty liver disease. So fatty liver, it is very easy to understand that you are having fatty liver when your weight is more than the height minus 100. That is the ideal weight. For example, if somebody is 180 centimeters, his ideal weight should be 80. And if it is more than 80 kgs, definitely he may have fatty liver. There are other comorbid conditions like diabetes, blood pressures, heart disease, CVA, that is the brain stroke, thyroid, cholesterol, and PCOD. These are the conditions where the persons can have fatty liver. Although we know that the fatty liver is causing these problems, it is not the vice versa. So fatty liver is very common in these comorbid conditions. Third, if you are having outside food, oily and spicy food, and alcohol, or you may are having some processed food like chips, like bakery items, then you may have fatty liver. So these are the things where you can actually assess yourself that you are having fatty liver or not. So it's very simple to understand. Second, if you are having more bloating, digestion issues, then you may have fatty liver. Third, if you are having hyperpigmentation on the nape of the neck, or you are having warts, or even the skin of the hands are dry, rough, and skin is hyperpigmented, then you may have fatty liver disease. Fourth, if you are feeling fatigueness in the morning hours, more in the evening hours, then definitely you may have fatty liver disease. You may have some health checkups, and then you may have in the ultrasound, the liver is enlarged, where the size is more than 14 centimeters of the liver. Definitely you may have fatty liver. Or your liver function test where the liver enzymes, the SGOT or SGPT is more in higher range, then you may have fatty liver disease. So friends, these were the important things which we introduced today as a fatty liver and fatty liver disease, and the symptoms or the assessment you can actually make before going to your nearest doctor. So in the next episode we will be discussing about regarding the symptoms, more about the complications on the cirrhosis, fatty liver disease, and the other problems you may have. We care about you.